Good evening, everybody. I hope your weekend is off to a good start, and I hope this Facebook Live session is going to be a very informative one. And I am Dr. Pallavi Kalghatgi, a gynecologist and fertility specialist at Xenith Fertility Center in Pune. We have two branches, one at Wakad and one at Koregaon Park. And I think without waiting any further, I'll just jump into today's topic for the FB Live, that is thyroid disorders and infertility. So, I'm sure most of you, whenever for any, like whether you go for to the gynecologist for menstrual disturbance, or if you're having any infertility issues, or you're experiencing weight gain or any kind of change in your body, and when you go to a doctor or a gynecologist, especially for females, they'll always give you a panel of hormone tests, to be done. In that, you will have a lot of hormones, and definitely I'm sure a thyroid panel or a TSH blood test or a serum TSH is always there. But it is never highlighted as to why are we doing the TSH. So today's topic is primarily going to be related to these thyroid disorders and how it affects infertility primarily. So, why is it so important? So, why are we talking about thyroid suddenly? We talk about hormones like estrogen, progesterone, prolactin. All these hormones come in the fertility panel usually. So, why thyroid? Well, first and foremost, the most important thing is 1 in 8 women usually develop a thyroid disorder in her lifetime, which is actually quite a big number. And like I said, thyroid may sometimes show as, with some symptoms, but many a times it can just be a subclinical thyroid disorder where you may not have any symptoms, but you may experience the consequences of a dysfunctional thyroid gland. So, a thyroid gland can be underactive or overactive, which means that the thyroid function is not working properly or it is working in overdrive. And both these conditions can cause a negative influence on the body, and primarily to the sex hormone metabolism, which is very important in fertility, and of course ovulation, implantation, and embryonic development. Again, three very important points for fertility. Thyroid affects males also, but the incidence of it affecting males is lesser than in females. So females are affected more. Okay, so keep saying thyroid gland, but where is it? And what is it? How is it functioning exactly? So thyroid gland is usually present at the base of the neck, and it is shaped like a butterfly, and this gland is connected to to a few other glands in the brain. Okay, so there is the hypothalamus and the pituitary gland. Both of them are situated close in the brain, and this axis, the hypothalamic pituitary axis, is actually regulating the thyroid gland, and this in turn is also regulating the reproductive function. So what happens is that the pituitary gland that I said is in the brain is secreting this hormone called thyroid stimulating hormone (TSH), which is very commonly a test done in the hormonal panel. And this TSH hormone is secretes the primary thyroid hormones, that is T3 and T4. And these thyroid hormones are basically regulating your entire body, right from the body metabolism, the growth, the body temperature, the energy that you have to perform your daily activities, and of course the other hormonal balance as well. So the thyroid is basically holding a lot of responsibility. The thyroid gland is holding a lot of responsibility to regulate your entire body. So what happens when things go wrong? So when basically, um, if the thyroid levels are normal, if the TSH levels are normal, everything is functioning properly. But if your thyroid gland decides to become underactive, as in it is not producing enough number of the thyroid hormones, that is T3, T4, it slows down the body function. Similarly, when it is working in overdrive or when it is an overactive thyroid, the systems are working faster and are working in overdrive. And there is a third condition which I will be talking about later in detail. Do not get confused with this diagram. It simply means that there is something called as thyroid autoimmunity as well, wherein your own immune system, now we are all born with an immune system. When we get an infection, when our body is hurt, when our body is injured, there is our own body mechanism which is helping to combat that injury or that inflammation or that hurt. So that is the immune system of our body. Now, when this immune system usually works when there is some kind of damage to the body or some kind of injury, like I said. But sometimes the immune system can get active without any reason, and it can create antibodies, and these antibodies can go and affect particular organs. In this case, since we are talking about thyroid, these antibodies go and start attacking the thyroid gland. So it is basically considering the gland as an outsider and it is going and attacking it. That is how the immune system works. So this is where what we call as thyroid autoimmunity. I will be talking about it in the future slides. So basically, these are some functions. So what can go wrong? Your thyroid gland can work in work in a hyperactive way. It can work in an underactive way, or it can your body can create antibodies and cause an attack to your thyroid gland. So what happens? What happens? We already know that a few things, but basically in the menstrual cycle, because we're talking about fertility, it affects the ovulation primarily. It causes anovulatory cycles, and obviously, because of that, it affects the fertility. It changes the length of the cycles. The cycles can come more frequently, or they are very far apart. Even when you're bleeding, you may have prolonged, instead of bleeding for 5 days, you may bleed to up to 7 to 8 days also if you have a thyroid function. You may, the estrogen and progesterone, which are the primary sex hormones, they get imbalanced. And there could be a short luteal phase. Now, the luteal phase is basically the second half of your menstrual cycle, that is between the ovulation and your period. So that is a very important time of your menstrual cycle, because in case you have conceived, or if you are on the verge of conceiving, that phase should be in a balanced hormonal pattern, so that it is going to support the process of fertilization, implantation, and so on. So that phase, luteal phase, has to be well supported. And it thyroid can affect this luteal phase and can shorten it, and further can lead to infertility. So same thing. It prevents ovulation. That's how it leads to infertility. It lowers the estrogen and progesterone hormones. Thyroid can do that. Thyroid disorders, very important, it allows, even if fertilization does occur, it does not successfully implant that fertilized embryo, and that is again a very important thing. And the fourth important thing is, even after you have conceived, it can cause high risk in and cause early miscarriages in the first trimester. So in fact, a lot of women do come with that history where they have had a single or a miscarriage more than twice, and they don't understand what could go wrong, because whenever you get pregnant, you feel that okay, I am fertile, and that is true. But a simple imbalance in your thyroid function can actually lead to continuous miscarriages, or can lead to an abnormal pregnancy, and that is why it is very important to get evaluated. Now, the three main types of disorders that can affect fertility is hyperthyroidism, and thyroid autoantibodies. I've already spoken about it before. So let's go on to hypothyroidism. The causes. Okay, so first let's talk about the causes. What could go wrong uh, in the thyroid gland, which will lead to this kind of dysfunction? So, like I said, a lot of the thyroid hormone secretion is dependent on the hypothalamus and the pituitary as well, because it is getting secreted in a cyclic pattern, and the TSH, which is released from the pituitary, will secrete the thyroid hormones. So, if the pituitary or the hypothalamus is damaged for any reason, it can dysfunctionally produce less or more number of thyroid hormones as well. So if it could be in cases where there is a damage or an inflammation to the hypothalamus or to the gland itself, to the thyroid gland itself, if there is an inflammatory process or if there is an infection, it can cause hypothyroidism. If in cases of iodine deficient diet, because iodine is very important for the metabolism of the thyroid hormones. So in iodine deficiency also this can occur. In cases of any surgery of the thyroid gland, partial or complete removal of the gland, where the gland is not present at all to produce the hormones, this situation can occur. There are some drugs that can also affect the normal functioning of the hypothalamus, pituitary, and the thyroid gland. So these are a few things. Sometimes, if you, especially if you carry a hereditary uh, carrier for hypothyroidism or hyperthyroidism, it can occur as an anomaly when you are in the intrauterine phase of your life. Okay, when you were in the womb, that time also there can be some genetic predisposition to a thyroid disorder. So that was about the causes. Now symptoms. Now the symptoms that I'm going to be talking about here is not related to or is the non reproductive symptoms. So in hypothyroidism, we see a lot of weight gain, fatigue, hair loss, dry skin. We see constipation. Uh, the person suffers from a lot of irritability, anxiety. You feel like your brain is facing a lag, as in you do not your cognitive function or the function to understand or to comprehend certain things that are told, which were easily understood before, they tend to get hampered. Now the symptoms that I'm saying are not going to be always present. Based on the level of thyroid disorder, these symptoms can keep varying. However, weight gain and hair loss and dry skin are very common symptoms. So they can be present. They can be present in even the subclinical type of hypothyroidism. But when I say in irritability, depression, or even the the lagging or the brain fogging, that is seen in very severe cases, and that should and that is one of the symptoms of hypothyroidism. But moving, let's talk about how hypothyroidism affects the fertility. And mind you, though though hypothyroidism in men is probably less common, but it still does play a role. So when we talk about female infertility and hypothyroidism, like I've already spoken about it, thyroid is basically the axis, or the hypothalamus pituitary axis, that is regulating the thyroid, is the similar axis for the menstrual cycle regulation or the reproductive hormone metabolism, right? So it affects directly, it goes and affects the menstrual cycles. And obviously when it affects the menstrual cycles, it affects the ovulation, it affects the luteal phase or the second half of the cycle, and that is why it can lead to some kind of subfertility. I've already told you before, it can be a very important cause for miscarriages as well. And one very important point is that if you have conceived when you are hypothyroid or hyperthyroid, it is And if your thyroid, I mean, if you have conceived and you're not aware of your imbalance in thyroid hormones, it can also have a high risk in the development of the baby as well, which is very important. So that is why thyroid profile is something that is done as a basic investigation even to a pregnant mother. So having a functioning thyroid is so important that it can actually affect the development of the baby as well. So that is why it is a very critical hormone. Also, if you are getting treated for infertility, or if you are trying for pregnancy, the fertility outcome is also reduced, and there is a lot of research on that which is confirmed that even a slightest dysfunction or slightest uh, change in the value of your thyroid hormones can affect fertility outcomes as well. In male infertility, we see a lot of men who complain about impotence or have less sexual drive or have erectile dysfunction. The good part about this is that the moment the thyroid levels are brought back to normal, all these symptoms that we see go back to normal, and they actually disappear. So that is the good news. Another important point is that a lot of studies. So basically, when we talk about male infertility, we primarily talk about the semen analysis. And when we talk about semen analysis, we talk about the sperm count, the motility, the morphology, the viscosity, the pH, all these various factors that are there in the sperm quality. So hypothyroidism is known to primarily affect the morphology, as in the structure of the sperm, and that is a very significant parameter that gets affected in hypothyroid men. So this is how it affects both male and female infertility. Moving on to what is hyperthyroidism, the reasons, the causes for hyperthyroidism is similar to hypothyroidism. Same thing: damage to the pituitary, hereditary factors, an infection to the thyroid gland. All of that pretty much remains the same. But the symptoms are a little different than hypothyroid. In hypothyroid, like I said, you experience weight gain, but in hyperthyroid, you experience weight loss. Your appetite increases. In hypothyroid, you have constipation, but in hyperthyroid, you may have diarrhea. So these are some similar. Yeah, these are some distinguishing factors. But symptoms like depression, anxiety, especially anxiety and irritability, can be present in both. So even when your thyroid is in overdrive, you may experience insomnia, or you may experience a very hyperactive behavior. And a very important symptom of hyperthyroid is tachycardia or experiencing palpitations. So you're sitting in one place, you are probably sweating, because sweating is also a very because you don't have tolerance to heat, so you probably are sweating, and you suddenly start experiencing a lot of palpitations, or sitting in one place you feel like you've run a marathon, because your heart is pounding and you're feeling like you're having a lot of palpitations, or you're feeling breathless. So this is something very commonly seen in hyperthyroidism. And actually, hyperthyroidism is not as common as hypothyroidism. So if you analyze a group of women, and if you get their thyroid levels done, the chances or the incidence of having hypothyroidism is more than hyperthyroidism. So hyperthyroidism is not as common, but these are the common symptoms that we experience. Again, talking about female fertility, the reasons pretty much remain the same. It affects the menstrual cycle. It causes is associated with more miscarriage. So here it is, instead of hyperthyroid is associated with more number of miscarriages than hypothyroid. And in male fertility, again, there is erectile dysfunction, and the motility and the sperm count is primarily hampered in hypothyroidism. Again, they're all reversible. The moment the thyroid function is got is you have taken the necessary treatment to get a normal thyroid value, your the symptoms also come back to normal. Now, talking about thyroid autoantibodies, I've already spoken about it, but basically, it is the immune system working against you, against your body, and it starts attacking the thyroid gland. When it starts attacking the thyroid gland, there is damage, and that is why the thyroid hormones are produced in a irregular manner, and that is what is called autoimmune thyroid diseases. Now, the two most important type of autoimmune thyroid diseases is Hashimoto's disease and Graves' disease. Definitely, you don't need to remember the name, but it is just for your knowledge. Hashimoto's is associated with hypothyroidism, and Graves' disease is associated with hyperthyroidism. Now, these are two diagnosed, well-known conditions. But sometimes, even if you do not have these conditions, or even if they are not diagnosed, and even if your thyroid gland is functioning, or thyroid gland is functioning normally, it is still possible for some thyroid auto antibodies may be present. It is still possible that thyroid auto antibodies are present. So it is necessary to evaluate them because, like I said, in subclinical cases, you may not show symptoms, but they may be present and they need to be corrected. So, like I said about Hashimoto's and Graves' disease, uh, in Graves' disease, you will have symptoms similar to hyperthyroidism. Along with that, of bulging eyes and goiter, that is swelling of the gland, can are prominent features in Graves' disease. Whereas in Hashimoto's, you will have lot of brain fog and again swelling of the gland. So these are two differences that you would see in both the conditions. A lot of studies have shown. Now, why do we keep talking about thyroid auto antibodies? Like, okay, so so the body has decided to attack the thyroid gland, but why is it so important, and how do we know that it is being affected? So, 50% of the women with Graves' disease or Hashimoto's do experience infertility. So, if not diagnosed, or if the tests are not done, you wouldn't be able to put a pin to the cause of infertility, and that is why it is so important. And it is just another blood test, but actually it is a blood test that gives you a lot of information. So that is why thyroid auto antibodies are so important. Also, like I said, you may not have symptoms, but the presence of thyroid autoantibodies will give us a direction towards the treatment needed for that particular fertility problem. So, if you are experiencing a miscarriage, or if you've had a past history where you've had a bad pregnancy, where you had to deliver in the 6th month or in the 7th month, and you didn't, there was no real cause. There was no history of preterm or no infection, no fever. There was no real cause for that kind of an episode. So, getting your antibodies checked, thyroid antibodies checked, becomes very simple, becomes very easy to diagnose the cause, and so that in the next pregnancy, it can be taken care of. Also, an important thing is thyroid antibodies can be present in uh, in any time of your life. So you may not have it you may not have it from the beginning or when you're born. You may develop these autoimmune antibodies over a period of time because of probably some past history, some history of infection. If you carry the predisposition to such kind of antibodies, it may show up later on in life. So even if you had a healthy pregnancy in the before, and right now and the second time you've experienced some kind of a bad history or a miscarriage or a preterm delivery, that time also it is very important to get the antibodies checked. And that is why a lot of you must be getting confused as to that, the first time everything was fine, the second time I'm experiencing issues, and you're suddenly bringing up something about antibodies. So at that point of time, it is important to understand that these antibodies can show up or can predispose at a later aspect of life as well. Also, like I said, thyroid disorders can have an increased risk in the cognitive function of the baby as well, in the development of the baby as well, and that is why it is important to get evaluated. So, what next? Now, we spoke about all of this. This happens, and uh, we have spoken about what all could go wrong, but what do we do next? The important thing is that if you are experiencing, in any case, thyroid profile is something that is done as a normal fertility assessment nowadays. But just in case you are experiencing some kind of infertility issues, or experiencing miscarriages, or any of the other symptoms that are mentioned, like for example, I spoke about weight gain or excessive irritability or brain fogging. These are some things that you would experience naturally also in your day to day life. But if it is present in excess, or if it is present very prominently in the last few months, it is necessary to visit the doctor and get your thyroid functions done. Definitely, the symptoms will help us to get some idea, but blood tests are the only confirmatory diagnosis that we can get. And of course, if your doctor is sees some kind of swelling near your throat, or while swallowing, if she sees a little prominent movement of your gland or of your throat, then in that case a physical examination will also be performed. Okay, and we all know the thyroid, TSH, that is the thyroid stimulating hormone, is the first and the standard test that is going to be suggested by your doctor. Now, the thyroid test is basically telling us, is reflecting your thyroid hormone, because like I said, TSH is produced by the pituitary. The pituitary is at the base of your brain. If TSH is normal, the T3 T4, that is the thyroid hormone which is produced by a thyroid gland, is going to be normal. So the TSH is basically the reflection of your T3 and T4. So these are the basic hormone thyroid profile tests that will be done in your thyroid panel. So this is going to help us understand if you are hypothyroid, hyperthyroid, if you have some kind of subclinical thyroid, because sometimes the thyroid, the T3, the T4 levels may not really be abnormal, but the TSH may be abnormal. So in that case, you have a subclinical disorder, and that needs to be taken care of as well. If in these basic tests you experience uh, there is some abnormality, there is a little bit, or there is a little or a higher value, or something that is very abnormal even after taking a thyroid medication, in that case an antibody profile is also done to rule out any kind of autoimmune disorder. So this is what a basic thyroid panel looks like. Mostly, the best part about this disorder is that the simple uh, treatment, or the simple approach for any thyroid disorder, is mostly a medication or a tablet. Okay, hypothyroid, which is very common, which is seen very in fact, hypothyroid is seen is associated with a lot of other issues also. Like for example, it is associated with obesity, it is associated with PCOS, so it is associated with high prolactin values. So because all of this are in that same axis that I was talking about, so hypothyroid is something that is very common and there's nothing to worry. The good thing is that a simple treatment, a modified, a very controlled dose, so dose related tablet can take care of your thyroid values and can take care of hypothyroidism. And all the important, all the drawbacks or all the complications that can arise with hypothyroidism immediately reverse back. So that is a simple treatment. And same with hyperthyroid, antithyroid medications will help. In very very rare cases, a surgery may also be required, and or a treatment with radioactive iodine. So that is how we approach hypothyroid and hyperthyroid. Whereas in autoimmune disorders, like I told you, in Graves' disease and Hashimoto's, there is a lot of like eye issues or skin disorders, cardiac or neurological disorders associated with the thyroid dysfunction. So it is a syndrome. It is a grave. It is like a many aspects of your body gets involved, like ophthalmic, like eye disorders or skin disorders. So it needs a multidisciplinary approach. So the autoimmune aspect of thyroid disease needs to be taken care of in a little different way. You need to involve a lot of other specialists as well to take care of it, so that nothing is missed out. So the autoimmune aspect of it is a little bit complicated, but very, very much treatable. So this is about the thyroid disorders and how it affects infertility. The main reason for this talk was basically to bring about the awareness that how important the thyroid hormone is. A lot of people get this thyroid profile done in their routine workplace. In fact, a lot of workplaces have routine examinations done at a yearly basis or a 2 yearly basis. So they're usually done, and that is a good thing. But let's say you've got your thyroid profile checked maybe a year back, or maybe 1.5 years back, or 2 years back. So it still does not mean that you need not develop it later. So getting, especially when you are trying to conceive, or you're taking an infertility treatment, getting your thyroid panel done is a very, very basic thing. And because the thyroid hormone has such large effects even after you conceive, it is very important to make sure that the levels have come back to are in the normal range even when you try for conception. So I hope this talk, brought about some knowledge and some idea about the thyroid functioning. Please remember never to get any tests or thyroid any kind of investigations done without visiting your doctor, because there are many aspects to it. There is a lot of examination also involved. So the best person to guide you for how to get evaluated is definitely going to be a specialized doctor. So that is something that needs to be told by a doctor, but the information and the awareness is important. And how to look out, or not to worry about something being abnormal. So that was the whole point of today's talk. I hope it was useful, and I hope I could bring about some correlation between the two. And so yeah, that is all for today. All of you have a happy weekend.